Nice to meet you. Thanks for answering our questions. The air quality index right now is at 152, which I understand is a unhealthy stage. Could you kind of explain that to us, please?
Yeah, so right now the air quality in Rochester and actually much in the region, the Northeast and the Midwest is being affected by these Canadian wildfires, which are in Quebec, and kind of due to the winds and things I don't fully understand are leading to changes in air quality locally. So what that means is the air quality index is kind of a measure of the amount of kind of pollutants in the air, not so much allergen. So that can and that air quality can therefore affect your respiratory status, particularly individuals who have chronic respiratory conditions, asthma, emphysema, things like that. So the air quality is lower than typical, especially for our area, for not a huge metropolitan area, and it could have impact on individuals' respiratory status, especially those individuals with chronic lung conditions.
You kind of answered my next question. I was going to say, who should be the ones staying at home right now because of these hazy conditions?
Yeah, so I mean, it can affect anyone. I haven't been lucky enough to be outside today, but I hear you can actually smell smoke outside. I can certainly see it outside the window. So it can affect anyone, but the folks who are going to be most prone to having respiratory symptoms from this stuff is anyone with an underlying health condition, significant asthma, emphysema, those things come to mind. Now, we want to keep things in perspective, although the air quality is suboptimal and not what we're used to around here. Um, the impact it has, the degree of impairment it has, should be modest for most individuals, but you want to be aware of it.
Thank you.
Thank you. Channel 13, anybody on from you? Okay. Alicia, you have a question? Channel 8? Dan, do you have a question?
Um, yes, I am aware that Rochester Regional Health does cover a lot of ground in Wayne County. Dr. Mustafa, I know basically you've mentioned that yes, the impact it has should be modest, but it really can affect anyone, especially those with significant asthma and emphysema. Are you, what advice would you give to Wayne County residents and surrounding areas? Because it's not just Wayne County. My newspaper, we cover Wayne, Cayuga, and
Sure.
Oswego counties. And I kind of wondered, what should area residents cover because they're under the DEC's, excuse me, the DEC's air quality advisory that expires at midnight tonight, if I'm not mistaken.
Yeah, so Dan, thanks for your question. It's certainly Wayne County and surrounding areas, but even more than that, right? There's similar conditions in the Midwest as well, Wisconsin. This is pretty widespreading. So, what you want to be thoughtful of is, I don't think we don't want to overreact. I think it's appropriate to be outdoors for the things you need to do, but you want to be thoughtful about it. And if you're feeling impact on respiratory health, that you might be, and then to potentially curb whatever you're doing if you're exercising outdoors or spend more time indoors. The analogy would be for individuals who are exposed to significant tobacco smoke, which is less and less these days. But if you're around significant tobacco smoke, it can certainly be irritating. It can certainly affect how you feel. So this is almost a similar analogy there that it's not like I expect individuals to go outside and have significant respiratory difficulties immediately. But if you're outdoors, you're exercising, you're playing outside, temperature is relatively nice and you're being impacted, just be thoughtful of it and be aware of why it's going on today. And it should be relatively short lived. You mentioned that it expires early tomorrow morning, the advisory. And these conditions can come and go. They're based on a myriad of variables, prevailing winds, things like that. So awareness, I think, is important, and then just taking kind of common sense risk mitigation.
So again, the analogy would be to be exposed to significant tobacco smoke. So if you're outdoors exercising or playing, you may want to use caution. Is that
Yeah.
correct?
Yeah, I think so. I think that's a reasonable analogy. It's not so much an allergy out there, this pollutant, but it's a pollutant. It's an irritant, right? So anything that can irritate the respiratory tract, tobacco smoke is something that comes to mind quite commonly, but this is not that different. So to be aware of it, and of course you want to minimize exposure if you're feeling any effects. Short term, long term, of course, if you have those effects, it can have a tremendous impact on health. But this is short term, and I didn't expect anything like that from long term or any long term concerns.
Okay. So it should be short lived. I did check the weather service. They're calling for haze through the rest of the week.
Yeah. And by short term, I mean hours, days, even a couple of weeks or so, not like a lifelong exposure to tobacco smoke as an analogy. That's a different concern, right? But we're certainly not talking about that with the environmental air quality.
Okay.
Thanks, Dan. Wayne 1180 has a question. A number of schools in our area already canceling outside PE and sports. Do you feel that's an appropriate measure?
Yeah, so I mean, I don't claim to be any expert in air quality. I'm an allergist, clinical immunologist. We certainly take care of a lot of individuals with respiratory conditions, but I think today being somewhat atypical, I think it's a reasonable approach to canceling outdoor PE and sports for today. Again, this is short term. It shouldn't be long lasting. There are lots of individuals, allergic conditions. Asthma is prevalent in 10% of the population. So in a typical classroom, that's a couple kids, a couple individuals. So I think it's a reasonable approach to absolutely out of an abundance of caution. I think that needs to be noted, and schools and districts are taking these measures out of an abundance of caution. But I think it's reasonable, and if it's short-lived, it's okay. Now, you don't want to be doing that for a long period of time, but there's no reason to believe that would be the case.
Thank you. Lucas, do you have a question? Okay, Raquel, question?
Hi, Dr. Mustafa. I think everything has been answered. I guess overall, I'm just saying that people should not be panicking, correct? Because there's a lot of panic out here. It's Rochester's on fire, so people should not. Can we speak on like the panic? Should people be panicking, and at what point should we really be concerned?
Yeah, there's absolutely no reason to panic. Certainly changes in air quality are happening on a daily basis. Today's change is a little more pronounced, and it's visible, and you can sense it, you can smell it. But there's no reason for panic. These changes have modest impact on respiratory conditions for the vast majority of individuals. For those who are most sensitive, it may have more impact, and that really can be alleviated by minimizing exposure. We should be going indoors, but there's absolutely no reason for panic. And we're kind of blessed. We don't get impacted by this type of air quality changes that often in our area. Major metropolitan areas out west where wildfires and population is different, kind of deals with these things much more often than us. But for sure, no reason for panic.
And here in our news station, we have a lot of pet lovers. I don't know if you can speak on that or not. What should people be bringing their pets inside? What are some precautions that should be taken for animals?
It's hard to know. I mean, I think most pets would fare very well even in today's conditions, air quality. Your doggies still need to go for walks and things like that. Again, just be thoughtful. If you feel like you're being impacted, maybe shorten the walk a little bit. But again, I think most of us could go about most common sense activities without much difficulty. But again, if you're not feeling well, if you're feeling like the air quality is irritating, your sinopulmonary tract, you can certainly be more thoughtful, be inside. There's a question about air conditioning, certainly being in air conditioned closed windows can sometimes help with this stuff in the short term. The role of masking may help with some of the irritant nature of the air quality right now. Some people think masks are irritating themselves. Is it helpful to you, or is it actually more irritating? So I think in the absence of significant health concerns, no reason for panic. I think we all have the choice, and we all have our individual choices of what's kind of best for us, and how to kind of just minimize any irritation over the next day or two or week or the short period of time that we have to deal with it, hopefully.
Thanks, Raquel. And I think you answered the question there from Spectrum about air conditioning and masking. Does anybody have any other questions we want to get in?
Yeah, going back to the masking, because I was going to ask this question. Do you recommend people before they go out to bring a mask with them in these conditions?
Yeah, it's hard to make a thoughtful recommendation, Patrick. I think, again, many of us have masks laying around coming off of this COVID pandemic. I think for some individuals, if you're outdoors on a day like this, masking can help. Some individuals, even with allergies, when they're mowing the grass, sometimes find masks to be helpful, but others find it not to be helpful or, in fact, actually more irritating or more uncomfortable for the face. So I don't really, it's impossible to make a strong recommendation. I think it's individuals. If you think it helps you being outdoors, certainly I don't think there's any downside to wearing a mask. We've been used to it for years now, but it's far from a recommendation or something we should all be doing.
Seth, I'm sorry, I left you out there. His question about spring allergies already affecting people this week with the cottonwood and the pollen in the air. So how does what happens with this smoky haze now?
Yeah, so this haze will serve as an irritant to our sinopulmonary tract. It's not truly an allergy. Starting in March, April, May, we've been dealing with a lot of tree pollen, which is actually, Seth, mostly going away. The predominant allergen right now is grass pollen, the white stuff you see on your lawns. That's grass pollinating. And if you're having a lot of allergy symptoms right now, it's probably from grass allergy rather than tree pollen allergy. I think a lot of individuals have felt some relief with environmental allergies over the last week or two. That's because we're transitioning from tree to grass allergy. The haze is just kind of like a second hit, a little more irritant, pollutant in the short term, but again, it should have very little impact long term on any sign of pulmonary symptoms.